Welcome to MLT online classes. So in this lecture I'm going to discuss about bleeding disorders. So what are bleeding disorders, students? So bleeding disorders are a group of disorders that will cause excessive bleeding. Alright. So whenever we have these conditions, we will have excess prolonged bleeding. So bleeding disorders can be broadly classified into two types. So they are acquired bleeding disorders and inherited bleeding disorders. Acquired bleeding disorders means these are the disorders which are acquired due to some external factors. So these called as acquired bleeding disorders, whereas inherited bleeding disorders are the disorders which are inherited by nature due to the genetic problems which are inherited from our parents. So let us see what are acquired bleeding disorders. So first one is liver diseases. Liver diseases can cause bleeding disorders. Can anyone say how? So liver is the major organ which will produce all the proteins in our body, right? So what are the 13 clotting factors? Fibrinogen, prothrombin, tissue thromboplastin, calcium, labile, stable, prothrombin. All these are proteins which are synthesized by liver. So whenever there is a problem with liver cannot produce these clotting factors. Without clotting factors, blood cannot clot. If blood is not clotting, bleeding will be increased, right? So liver diseases, obviously they will cause bleeding disorders. So how we will get liver diseases? Liver disease can acquired due to alcohol consumption or viral attacks such as hepatitis or other conditions like drug toxicity or some other chemotherapies. These will cause liver problems and that in turn affects the bleeding. So one is liver diseases. Second one is vitamin K. As I already discussed, there are certain factors like 7, 10, 8 and 5. 8 and 2 clotting factors are vitamin K dependent clotting factors. In order to have their activity, they must need vitamin K. Absence of vitamin K, those factors cannot activated. Without those clotting factors, blood cannot clot and hence vitamin K results in excessive bleeding. So vitamin K also plays a crucial role. The third one is warfarin overdose. So what is warfarin? Warfarin is an oral anticoagulant. So whenever a patient has a disseminated intravascular coagulation, that means a patient has many clots within the blood. So this patient has been admitted in the hospital. Since the patient already has excessive clotting, it is wise to prevent that excessive clotting by giving some anticoagulants. Anticoagulants will prevent clotting of the blood, right? So one of the best anticoagulant is warfarin. We will give warfarin to the oral warfarin injection. So what warfarin will do? Warfarin will remove all the vitamin K from the body. It will eat the vitamin K. So without vitamin K, the 4 clotting factors cannot activated. So that is how warfarin will prevent bleeding. So it will cause bleeding. How means? If the patient will be given excessive warfarin and that warfarin will prevent complete clotting of the blood. If blood is not clotting, the patient will develop bleeding disorder. So excessive warfarin will prevent, it will inhibit vitamin K activity. Without vitamin K, blood won't clot. If the blood is not clotting, it will keep on bleeding. So warfarin overdose. Then disseminated intravascular coagulation. So whenever there is an excessive disseminated coagulations within the blood, they also causes excessive bleeding. There is a negative and positive feedback mechanism which will it's a loop, overexcitation of clotting mechanism that you need not to know. Just keep in mind, disseminated intravascular coagulation can also result in excessive bleeding. Okay. Then thrombocytopenia. Obviously, what is thrombocytopenia? Decreased platelet count. Platelet plays a crucial role in primary hemostasis, right? So without platelet, your bleeding will be increased. So what are the acquired conditions that causes decreased platelet count is such as some viral disorders like dengue or some malaria or some drugs or some auto antibodies that are developed towards these platelets will cause decreased platelet count. Without platelet, blood cannot clot and that results in increased bleeding time. So thrombocytopenia can cause increased bleeding time. Then renal failure. How a kidney failure can result in bleeding disorders? Kidney synthesizes one of the important hormone which is important for erythropoietic activity. So kidney will produce a hormone called erythropoiesis and this erythropoiesis is very essential for production of hemopoiesis, blood cells. Without So whenever there is a defect to the kidney, kidney won't generate erythropoietin. Without erythropoietin, no blood cells. No blood cells means no platelets. No platelet means no blood clotting. Then resulting in increased blood clotting, bleeding. So that is how acquired bleeding disorders occurs. Then coming to your inherited bleeding disorders. In inherited bleeding disorders, this is one of the important diseases, which is hemophilia. Hemophilia is a X-linked recessive disorder which is present in the males compared to females. Females are the carriers for hemophilia, whereas males are always affected individuals. So in hemophilia, what happens is clotting factor 8 will be deficient. So if clotting factor 8 deficient, this is called as hemophilia A, or it is also called as classical hemophilia. And if the clotting factor 9 is deficient, that is called hemophilia B, and clotting factor 11 deficiency is called as hemophilia C. So they are the inherited bleeding disorders. Then next is 1 milligram factor. Obviously, your endothelium of the blood vessels will secrete a substance called 1 milligram factor, and that is very essential for the attachment of the platelets to the 1 milligram factor, and they will in turn forms primary hemostatic mechanism, right? So whenever there are some conditions where the patient's endothelial cells won't secrete any 1 milligram factor, absence of 1 milligram factor in turn results in excessive bleeding. So that is 1 milligram factor. Then platelet defects. I hope you already know there are many platelet defects, aggregation defects, adhesion defects, platelet receptor defects such as 1B, 2B, 3A defects, or they will unable to secrete adenosine or thromboxane, or they are unable to metabolize the arachidonic acid to produce thromboxane. So all platelet defects will in turn result in increased bleeding disorders. If you know the previous lectures, then you can easily understand these bleeding disorders. Then the other one is fibrinolytic disorders. So fibrinolytic is a mechanism in our body where the body will remove the formed fibrin threads. These fibrin threads will be removed by a mechanism called fibrinolytic mechanism. When there is an excessive fibrinolytic mechanism, this in turn will remove all the clots from the blood, and blood won't clot immediately, and that results in a condition called bleeding disorder. So excessive bleeding disorder can occur due to excessive fibrinolytic mechanisms, and other conditions like other clotting factor deficiency can also induce bleeding disorders. So this is the lecture. If you have any notes, you can ask me later. Have a good day, students. See you in the next session.